Did you know that there is a disease that 50% of diagnosed patients still report symptoms while on a gluten-free diet? Definitely, celiac disease. Celiac disease is an autoimmune disorder of the digestive tract that occurs in reaction to gluten. Celiac disease damages the inner lining of the small intestine, and antibodies attack the intestinal lining, damaging, flattening, or destroying the tiny hair-like projections called villi in the small bowel. Therefore, the surface area is less, leading to less absorption. Celiac disease is sometimes misdiagnosed as irritable bowel syndrome, Crohn's disease, or gastric ulcers. Some people have no symptoms, although they are still developing intestinal damage. Symptoms of celiac disease can vary from mild to severe. Digestive symptoms may include abdominal bloating, pain, diarrhea, vomiting, constipation, painful smelling stools, and for some people, celiac disease causes an itchy, blistering rash known as dermatitis herpetiformis. But the main and most severe problem is that failure to absorb nutrients that may lead to other problems, including weight loss and malnutrition. Signs and symptoms related to weight loss or malnutrition can include anemia, fatigue, osteoporosis, infertility or miscarriages, mouth ulcers, tingling, numbness in the hands and feet. It often first occurs in the teenage years and is more common among men than women. The following factors place someone at greater risk for developing the condition: a family member with celiac disease, exposure to gluten before 3 months of age, major life event, emotional stress, pregnancy, or surgery in people who are genetically predisposed, type 1 diabetes, thyroid disease, other autoimmune diseases, Down syndrome, and Turner syndrome. For the diagnosis of celiac disease, you need to proceed with serologic tests to search for antibodies called IgA. The DQ2 or DQ8 genes that are considered necessary for a person to develop the celiac disease. But the gold standard for the diagnosis is endoscopy. A biopsy of the atrophic duodenum can confirm the finding of the blood test. There is no cure for celiac disease, but strictly avoiding gluten will heal and allow the intestine to repair itself. The most common foods to avoid include pasta, baked goods, and cereal, but you must avoid even small amounts of gluten that could be in other products. Important nutrients that may need supplementing include iron, calcium, vitamin D, zinc, copper, folic acid, and other B vitamins. If the symptoms continue and affect the quality of life, prescribe steroids to be taken orally or IV. Thank you. Bye.